Welcome to H&HN Daily. I'm Susanna Hopsolin, Senior Editor for Hospitals and Health Networks magazine. The deadline for ICD-10 implementation, October 1st, 2014, is less than 8 months away. The new classification system improves the documentation of health services, but poor implementation can lead to costly redesign and disruption of claims processing. Today I'm joined by Marty Faddick, CEO, Nemaha County Hospital, Auburn, Nebraska, and Stephen Stewart, CIO, Henry County Center, Mount Pleasant, Iowa, to discuss fast-tracking ICD-10. Welcome, Marty and Stephen. Thanks for joining me today.
Thank you, Susanna. It's great to be here.
Thank you, Suzanne. Good to be here.
Marty, what are the benefits of ICD-10 for the hospital?
Well, funny you should ask, because there are some benefits. Sometimes we think that this is merely something that the federal government has done to us, but there are some benefits. You know, we're looking at, as we move into a pay-per-performance, a value-based purchasing, ACO environment, we need very granular data.
What areas of the hospital does this impact?
It is insidious in about everything we do in the organization. From the obvious things, the building department, where coding is necessary, but also into things like quality management. ICD-10 codes will be involved there. What happens with your laboratory system? What happens with your radiology system? What about pharmacy? It is involved in all areas of your system, and especially if you happen to be an organization that uses best-of-breed software, each of the databases will need to be checked to make sure that they are ICD-10 compatible.
Stephen, what's a good way to ferret out some of these areas and uncover all the hidden areas that ICD-10 is going to impact?
You got to start with a gap analysis, and I think a great way to begin a gap analysis is to reach out to all the functioning departments of your organization and just ask them a very simple question. How do you use ICD-9 codes today? Where do you use them? What do you use them for? To me, you know, ICD-10 means I can get a clean claim out the door, and that is a really critical function. But I can't do that, or we can't do that, until we have every piece of the system that contributes to that remediated to ICD-10 levels. You know, fortunately for a small hospital like us, we had a lot of systems to look at, but we didn't have a ton to remediate.
How many systems do you really look at, even in a critical access hospital?
In our particular case, there were about 38 or 39.
When do you use outside help? Have you used any outside help?
We have not used any outside help right now. We have a very dynamic team in our hospital that is well prepared. If you aren't in the situation we are, and I know there are facilities that aren't, then outside help is very necessary. And you say, yes, but it costs so much. Well, the cost of not being ready is even greater than the cost of employing outside help. So I would encourage anyone who has a question about whether, if you don't know if you need it or not, you probably do.
Mm-hmm. What about you, Stephen?
Well, I think Marty hit the nail right on the head. It goes back to the beginning. The gap analysis will tell you the scope of the challenge that's in front of you. And once you realistically assess the scope of that challenge and analyze that versus the resources you have available to throw at it, you'll answer your own question of when you need outside help. I think another thing that's really critical to think about is come October 1st, if you are unable to bill claims, you are therefore unable to be paid for the services you've already provided. And in our particular case, and I can't think of a facility in the world where that's not a big issue. So Marty alluded to the fact that, you know, there's a comment sometimes that outside resources are expensive, but how expensive is it to not bill for a month, 2 months, 3 months?
How does this affect the physician workflow?
This is going to have a tremendous impact on physician workflow. Physicians are already under the gun as we move towards meaningful use stage 2. And this is just going to add to that complication. As physicians are going to have to document in a much more granular way what is going on with their patients. And it's going to take them a while to figure this out. Hopefully organizations We'll train their physicians well so that they understand the level of granularity that needs to be in place so that they can have clean claims go out the door. Otherwise, the HIM people, the coders, are going to have to send these. You have to contact the physicians and say, I need more documentation, which again will slow the physicians down, frustrating them even more. This has also got to happen in the physician clinic as well as in the hospital. So the physicians should have a motivation to do it right, because it's going to slow down their claims and therefore their cash flow as well.
For the physicians to take a look at what they've done and say, what are the top 50 diagnosis codes that I've used in the last 3 months? And really focus on those and getting to know those. Yes, there's still going to be some outliers that they've got to work on, but that takes this enormous task and breaks it down into a component that might be more palatable and more acceptable.
What about the payers? Are they ready for testing?
Some of our payers are ready. We have been contacted by our Medicare intermediary, our MAC, and they're ready to start testing in March. So we're anxious to work with them. Some of the other payers we have not heard from. Medicaid in our state is notoriously slow. I think Blue Cross will be ready without a doubt. But they're getting there. I think they understand the enormity of this problem as well.
Yeah, I think the key is to look at your payer mix and focus on the 3 or 4 payers that are going to make up 80 or 90% of your volume, and really focus your efforts there.
How can the CEO support the successful implementation of ICD-10?
The CEO, I think, has a huge responsibility to support the implementation of ICD-10, mostly through letting everyone in the organization know that this is a big deal, that he or she need to be constantly updated on how the progress is going. They need to support the additional hours, personnel hours, and funding that's necessary to make this happen as seamlessly as possible.
Thanks for joining us today.
Thank you.
Thank you.